Hi, I'm Eric Roberts. Seizures can affect the brain while they're happening and over time. Having fewer seizures and stopping them quickly is part of having a healthier brain. Rescue therapies can help. But remember, they're not meant to replace your daily seizure medicines.
I was first prescribed a rescue therapy after a 16-day stay in the epilepsy monitoring unit. So my husband and I were a little nervous, so we actually talked to the doctors and the nurses asking, is there anything that we should do safety-wise to make sure that we'd be okay going home? And that's when we first started the conversation about rescue therapies and got a prescription for one.
Most adults with epilepsy have not heard about rescue medications, or they don't think a rescue therapy is for them. Sometimes they feel that they don't need a rescue therapy. They don't know that having a rescue therapy could help them. Or they think that the only option for a rescue therapy is what they had as a kid. But things have changed.
Having the rescue medication, thank goodness I have not had to use it. I hope that I never do. But having it is definitely comforting for sure. And I try to make sure that whoever I'm around or with knows how to use it. So like even today I went to the gym and just real quick before the class started, I told the teacher, I was like, hey, here's what I have going on. God forbid something happens, here's what to do. And I showed them how to use it and everything.
Before I had a rescue therapy and I was living alone in a big city, I was a little more nervous about traveling by myself and, living alone. But now having a rescue therapy as part of my tools for treating my epilepsy, I feel much more confident to be able to take the L to get around the city here in Chicago, to travel.
Everyone with seizures should learn about rescue therapies and talk with their healthcare professional about what is right for them. Rescue therapies can be used when your seizures are different from your usual pattern. For example, if you're having groups of seizures or more seizures than usual over a given period of time. Rescue therapies might be used if a seizure happens during a high-risk time, when something is different from normal. Some people have seizures when they are more stressed, or when they're not getting enough sleep, or when they're sick with an infection or a fever.
Rescue therapies are medicines prescribed by a healthcare professional, designed to start working fast to stop seizures when they happen.
They can help seizures end faster so that you can get back to what you were doing. Rescue therapies can reduce the chance that you'll need to go to an emergency room, be hospitalized, or get injured. Rescue therapies usually work fast, within minutes, and can stop more seizures from happening if given right away. Rescue therapies can be given by anyone who knows how to use them. They do not need to be given by a nurse, a doctor, or another medical professional.
Rescue therapies should be part of your personal seizure action plan. Talk about it with your doctor.
So my need for rescue therapies have changed. I used to have daytime focal seizures, and now I have nighttime focal seizures. So I really rely on my husband to be the one to help when we do need a rescue therapy.
When I was looking for more information on rescue medications, one thing that helped me was to learn the names of different medications.
Here are the rescue therapies for adults that are available and approved by the FDA for episodes of seizures: diazepam rectal gel or Diastat, midazolam nasal spray or Nasalem, diazepam nasal spray or Valtoco. Some of these rescue therapies are also available for children. Other medicines that have not been approved by the FDA as a rescue therapy are sometimes prescribed to stop seizures. These medicines are usually put under the tongue, on the tongue, or between the cheek and gum to dissolve. But because these medicines are put in the mouth, they can be hard to give to a person having a seizure. It also takes some time for these medicines to get to the brain, so they may not start working fast enough.
If rescue therapies are new to you, don't be scared to ask your doctor or nurse for more information about them. That's what I did, and it really improved my care in my day-to-day life with epilepsy.
Still need more information? It's natural to have questions. Check out our other videos about rescue therapies and talk about it with your doctor.